Hi, can he or she continue to work or should he take leave? This is a frequently asked question by a family member once we diagnose somebody as having depression. Welcome to Mindscape Matters, a channel to discuss mental health and more. I am Dr. Mohan Raj. I am a consultant psychiatrist based in Chennai, and I'll be your guide as we explore this wonderful landscape. The answer to this depends on some factors. No, it is not dependent on the severity of depression. The factors that we look at to decide whether to continue working or to take off are the following. Number one, their work efficiency. Has their work efficiency come down due to depression? Number two, what does the work do to them? In other words, how do they feel about their work? And number three is the work the cause of their depression? There are some people who will continue to do their job well despite having severe depression. For example, a mother who is depressed will continue to cook for her children and also would look after their needs adequately. A working woman would continue to perform in her work very well despite having depression. Their sense of duty and responsibility makes them work at high efficiency levels. Their interest levels could be low, but they'll continue to do the work because the work has to be done. Somebody has to do the work and let me do it. In the process, their efficiency levels can be lower than usual, but that is still good enough. They would actually feel better while they are working because they know that they are making a difference in somebody else's life with their work. This gives them a sense of purpose in an otherwise bleak tunnel of depression. Their work is their primary reward. They feel happy while working. It is like visiting an happiness island in an otherwise unhappy sea of life. For such persons, we suggest that they continue working because work can be therapeutic for them. What I mean is, work will actually help them to improve better and faster. On the other hand, there are some persons whose work efficiency comes down due to their depression. They would continue to work at 30 to 50% of their former work efficiency. And the sad part is they are aware of this. They compare their former work output with the present and feel inferior. They think, I was like that and now I am like this. Their self-esteem drops and they feel inferior and worthless. Each day at work is a daily reminder that they are not good enough. This worsens their depression. For such persons, we suggest that they take leave from work. The third factor is whether work itself is the cause of depression. It could be because of a toxic work environment, or it could be because of an odd boss with a troublesome personality trait, or due to interpersonal problems. In such scenario also, we suggest that the person goes on leave. The next question would be, how long should the leave be? Antidepressants usually take about 2 weeks to start functioning, and for adequate improvement, it could take 3 or 4 weeks. If psychotherapy is used alone, it could take longer because we are trying to change somebody's perspective and also change their patterns of behavior. In mild depression, we could use psychotherapy alone, but in moderate to severe depression, psychotherapy is always used in combination with medicines. So our usual recommendation for leave would be for 2 to 3 weeks depending on the person's disability due to depression. Most of the colleagues know that this person is going through some emotional issues and are very empathetic, and they have no problem in sanctioning the medical leave. Occasionally, there could be this peculiar HR who has low trust level on the employee and the treating psychiatrist, and they would ask is there a blood test for depression? Incidentally, this question was asked by a mother and I have made a video about it. If you have not seen it, I'll give you the link in the description. The next question to consider is, what should they do during their medical leave? If they are idle, they are going to ruminate about their depressive thoughts. Their ideas of helplessness, hopelessness, worthlessness, guilt can escalate and can lead to more depressive mood. And we have seen earlier that the depressed mood can cause more depressive thoughts and they go into a vicious cycle. It's important that they occupy themselves in activities that they find are meaningful and which give them happiness, at least 10 to 20% happiness. These could be exercise, it could be music, or it could be any activity or a hobby which they were passionately pursuing earlier but are not able to do now because of the fast pace of life. Or it could be volunteering somewhere which they find it as meaningful and some sense of purpose is there. These activities will actually help them improve better. Some persons would feel that the office environment is the cause for depression and they would want to resign. Our usual advice to them is, don't resign, wait until you come out of depression before you make any major decisions like resignation, etc. We have done a detailed video about this aspect and you can watch it here. Thank you for watching this far. If you like this video, please tell 4 of your friends. Tell them there is a Tamil version also. Stay tuned because Mindscape matters. Bye.